Welcome to Webinar Wednesdays at RPI, and thank you for joining the Healthcare Solutions and Integrations with ECM. Webinar Wednesdays is a new webinar series hosted every first Wednesdays of the month here at RPI. A few housekeeping items before we get started. The webinar will be recorded and shared on our blog and on our YouTube channel in a few days. For those of you dialing in today, the slide deck will be shared via email immediately following this webinar. We also have a moderator standing by to take your questions, so please feel free to submit those to the GoToWebinar interface. If you have any questions or additional webinar topics or something you'd like to see presented, please let us know. As I mentioned, it is Webinar Wednesdays. So shortly after this at 1 o'clock, join us for another webinar about our new yoga updates. And again, that's our lightweight web client for ImageNow. And then later at 3, Abby and Derek will be going over the technical and solution health check offerings that we have. The next webinars are scheduled for May 2nd. There you can expect our webinar over the Outlook client with OnBase, an overview of the Kofax products and solutions, and then some of our project coordinators will be talking about planning your next upgrade. As I said, my name is Pitts. I'm a senior solutions architect here at RPI. I have about 6 years of experience with Perceptive Content, specifically within the healthcare space, and I love my dog, Tofu.
My name is Chris Tan. I'm a senior consultant here at RPI Consultants. I have 6+ years of experience with the Perceptive Content platform, primarily focused in the clinical healthcare space, and I am a husband and father of 2. And for today's agenda, we're going to give you a brief overview of RPI Consultants, discuss integration solutions for unstructured content, focus on healthcare workflows and solutions, do a quick products overview, and then end with a Q&A session. At RPI Consultants, we are a comprehensive professional services organization with over 18 years of experience designing, implementing, and supporting ERP, ECM, and advanced data capture solutions. We have about 80 full-time employees based out of our office locations in Baltimore, Tampa, and Kansas City. We offer many different services and specialize in the product partnerships with companies such as Hyland, Kofax, and Infor.
All right, integration solutions for unstructured content. Kind of coming off the HIMSS wave, interoperability and the HIE are prominent topics within the healthcare IT space. Integrating content is expensive, but very important to reducing costs, increasing your margins, and improving patient care. The challenge is incorporating unstructured content into your systems so that they're visible and accessible to everyone. The EMR should kind of live at the central point of every health system, and the ECM complements that application by holding content and allowing for those content-driven workflows. Where we're going to go over here are the principles of any patient-centric healthcare solution.
So to start off with, we'll discuss HL7 interfaces. HL7, or Health Level 7, is an interoperability specification for health and medical transactions. Our healthcare solutions are designed to receive inbound HL7 feed from the EMR, as well as generate outbound feed back to that EMR. Perceptive Content uses the CorePoint integration engine to accomplish this, while Hyland OnBase has built-in functionality called the HL7 module. We use HL7 to build and maintain the patient database within the ECM that covers the creation and update and merging of patient medical records. Regardless of ECM, in order to maintain the integrity of your EHR or EMR, the patient database is required in the ECM. During indexing, we're associating documents to charts within the patient database as opposed to the EMR directly.
Now with HL7 in the patient database in mind, what I wanted to go over is kind of the base solution for using your ECM as a legal medical record. And this is all centered around the document workflow. That can kind of be summarized in 3 steps: the capture, indexing, and retrieval. So with capture, we want to bring documents into the system. Your ECM is going to integrate with your scanners and your MFDs for any physical document capture. And then end users could also upload their digital content via imports or virtual printers or even through email. We do offer some automated capture points as well for those digital documents, and this is typically done by monitoring directories, creating documents out of an HL7 feed, monitoring inboxes, and then inbound fax lines as well is typical for like a scheduling solution. The idea is to get everything into the system first and index, and then we can kind of route those documents as we need to. So as documents are captured, indexing is that process of tagging those key patient and encounter metadata onto the documents to be filed into the patient's chart. Indexing can be automated or manual as well. Some of the automated indexing options are capturing directly out of the EMR. So as we capture documents straight from the EMR, the patient context is passed to us, so those could be applied onto the documents immediately. Another method of automated indexing is using those barcodes, typically document and patient or encounter barcodes on those documents, using an index file, or even in some cases we could perform OCR on those documents to pull their metadata. Of course, a lot of documents are not going to be automatically indexed, and the ECM provides these manual solutions for specialized indexing. Within the Perceptive space, this is typically done with a patient indexing eForm, or even some solutions within the Experience platform. And then OnBase, it's kind of built into their keyword sets. As the documents are captured and indexed, the next step is really retrieving them as they're already filed. This again is done really in two different ways. You can pull those documents out of the ECM directly using document or folder views, or navigating through the chart within the ECM. That's typically done with the HIM staff, or users who aren't typically working out of your EMR. For those users that work out of the EMR exclusively, like physicians or nurses, those documents are retrieved through specialized clients, all kind of related to that document ID, and we'll kind of go over those clients here in a second. With HL7, the patient database and document workflows in mind, we wanted to show you how these are applied to real-world workflows that you'll find in a hospital or clinical setting.
So for scheduling solutions, we built workflows to monitor fax queues to generate images that are indexed against our patient database. For registration and admitting solutions, there's a direct integration into the EMR where documents like photo ID or an insurance card are captured directly into the medical record at the point of service. As typical with an HIM workflow, post-discharge patient charts are batch scanned and indexed into the ECM. In some cases, barcodes are used to extract patient metadata and index against the patient database. These can also be used for document type identification, as well as patient and encounter selection. For incorrectly indexed documents, we have a records correction and misfiled document solution that allows HIM staff to reindex documents and automatically remove those document links from the EMR.
And kind of piggybacking off of those HIM workflows, after post-discharge, typically the coding and analysis workflow takes place, and this is where ECM really shines, because this is a very document-centric workflow. Your HIM coders are able to look at those charts, submit those physician queries, bookmark chart documents as they're needed, and then they can also route them forward to those analysis group. And the analysis group is where users are submitting their deficiencies, routing those charts again as they need, and then addressing the requests from the coders. Once those deficiencies are assigned to the physicians can complete those deficiencies all through the ECM. They can complete them, reject them, reroute them. There's even proxy functionality that allows other users to sign in the case of their absence. Chart deficiency tracking is a specialized solution that's really task-based. So, for example, with the Perceptive and Epic integration, the tasks are created within Perceptive. We send over an MDM message to Epic, which then files those chart deficiencies under the correct physician. The physician completes those deficiencies, and then Perceptive resolves that task on our end. Integration for 3M CAC is another kind of specialized workflow. This utilizes HL7 to submit those document hyperlinks over to 3M. So the users are really just working in 3M and then calling those documents as they need to straight from the 3M platform. Another workflow here with HIM is the release of information. This is typically a very manual and resource-intensive task, as users are locating the documents, copying them, and then delivering them as they're requested. Where ECM really shines here is it allows for the electronic processing and faster delivery of these records. Within an ROI solution, and this is across both OnBase and Perceptive, there's typically two different flavors here. A standard mode, which is really just a standalone solution, regardless of the EMR being used, where we kind of create workflows and scripts specifically around locating documents and then packaging them up for retrieve or for export. An integrated mode is where we integrate with the EMR directly. So an existing solution that might exist, for instance, the Epic ROI module within the Perceptive space, there's a ROI plugin that we could implement where the request originates from the Epic side, and then Epic passes us all the document IDs they're looking for us to then return them over to Epic, and then those are released via their own print servers. Kind of taking a sidestep from HIM, another big solution here is patient financial services. Hyland offers the healthcare revenue cycle management solution, which is very similar to this. But within the PFS world, we're capturing correspondence documents that are coming from the billing office and storing them into ImageNow. Here, those are stored into 3 different buckets. We have our patient accounts, which are just documents that are tied to any patient within the EMR. This is typically stored against an account number, like a HAR or a guarantor within the Epic space. Non-patient accounts, these are documents that aren't related to patients at all, and then legacy accounts, which are related to patients that don't live within the current EMR, so typically for like a legacy system. Payment documents, these are typically captured automatically and then indexed into our system. Think lockbox files or EDI files. And then we have a paper EOB process and cash payment posting. And this is really designed to complement that EMR's payment posting workflow. You batch capture those documents into the ECM. We send over ZBI messages to the EMR so that they can post them appropriately. And then through an EOB interface, they can recall documents down to the specific page number to locate what they're looking for. Now that we've seen how these solution principles apply to clinical workflows, ECM takes this a step further with specialized applications to serve the niche end users.
Clinical care facilities typically use a variety of complex software applications from different vendors. Because these applications are created by different software teams, these applications need to exchange data and typically do so via interfaces. The de facto language used to move this data between applications is HL7, which is an international message standard. The CorePoint integration engine is an interface engine that provides an enhanced test as you develop approach to creating interfaces that gives users the absolute confidence they can meet meaningful use requirements and also connect to external partners like Perceptive Content. Within the Hyland OnBase solution, the HL7 module is a listener, processor, and sender that simplifies the transfer of HL7 data between external applications and OnBase. In terms of integrated viewing, Perceptive Content offers the Interact for Epic and Interact Desktop viewing solutions. Interact for Epic and Interact Desktop provide embedded access to your Perceptive Content documents from within Epic's health information system. This tight integration allows you to scan and retrieve Perceptive Content documents based upon the currently viewed patient chart without leaving the Epic environment. For Hyland OnBase, the solution is integration for Epic. Clinicians can effectively capture, retrieve, and manage all clinical and non-clinical information without ever leaving their Epic application. Outside of these two, we also offer the RPI Yoga platform, which is a HTML5-based solution that renders documents from the EMR using a unique document ID.
Now we went over the solution principles of the healthcare workflow. That includes HL7, the PDB, and then document capture. And we talked about how these apply to a clinic or a hospital setting, and then we kind of talked about some of the specialized products. Again, this is all from a very high level, so we'll be taking any questions now.
Yeah, we have a few questions. The first is, can I keep my healthcare documents and processes distinct and wholly separate from my other processes, such as human resources?
Yep, definitely. Both OnBase and Perceptive offer this functionality. Within OnBase or within Perceptive, there's the concept of departments, which allow you to kind of segregate those documents as well as segregating their administration. On top of that, there are drawers that have always been around within the Perceptive world. Typically, we would build a medical records drawer for all your medical record documents, an HR drawer for all the HR documents as well. And then same idea exists within OnBase. Those are typically done via document type groups.
And as always, feel free to submit questions via the questions panel inside the GoToMeeting. What is the difference between Interact for Epic and Interact Desktop?
Interact for Epic and Interact Desktop are, for the most part, the same in terms of image rendering, providing that patient data directly from the EMR. However, one major difference between the two is that with Interact Desktop, you have the ability to enable what's called pre-retrieve, which caches the patient context from the EMR in order to give you real-time transition to various patient charts. So for Interact for Epic, you click on a hyperlink, you render that image, you go to another patient, you have to click on that hyperlink and it renders that image. With Interact Desktop, you can switch patient context within the EMR and Interact Desktop will recognize that and transition to that patient's record.
Is there a big difference in the solutions between Perceptive and OnBase?
As far as integrating with EMRs, not really. For Epic, for instance, Epic kind of dictates all of the integration points as far as ECMs are concerned. So for example, there's a scan API, so that's scanning out of like the registration module through the documents table or through like media manager. All of those scan APIs are kind of the same. They're exposed the same to whatever ECM you have. It's all configuration within Epic to call whichever ECM is appropriate in order to store those documents. Posting the links automatically, that's functionality as a part of the API. So both Perceptive and OnBase are going to accommodate that. Everybody can do HL7, sending those MDMs back and forth. As far as the integration points, they're very similar across the two platforms.
Clearly you have proven integration with Epic. What about other EHRs, and have there been challenges in that regard?
Yeah, definitely. I've done Allscripts, we've done point-click care, we've done Meditech as well. Pretty much any EMR, EHR is going to be somewhat compatible to ECM, as long as HL7 is a component that's involved. At least inbound, we can accommodate solutions that don't really have an outbound or like an MDM interface ready to go. But as far as any EHR or EMR, there shouldn't be a problem integrating those within the system.
All right, one last question. If you could have a superpower, what would it be?
Do you want this one?
Yeah, I would say flight. Flight would be my superpower. I just recently came off of a cruise, and there were times I wish I could get off it faster than the cruise took. But flight would be my superpower, absolutely.
Yep. Never having to be on an airplane again, right?
Yeah. All right. Thanks for all the great questions. Now we went over these topics at a very high level. So if there are any topics that we didn't cover or items that you'd want us to dive into further detail, please let us know for future webinars. I do want to point out a few additional resources that we have. If you visit our webinars page, you can register for upcoming webinars. You can also watch recordings from all our past webinars, and here's where you can submit those topics for future webinars. You can also visit our knowledge base, which has a lot of great content, including free white papers, case studies, product demos, and even help articles. Thank you.
Thanks, everyone.